Welcome to the National Health Review Hour, folks. This is your host, Andrew Gall, here on 1560 AM WINT. Good to have everybody back with us. Go ahead, Cynthia.
Hi, I'm Cynthia Calhoun, here with Andrew.
Good to have you here. How are you?
Good. How are you?
Oh, fantastic.
So what do we have on the agenda for today?
Great stuff today. Super excited about today's show. Got some neat things for us to talk about. Going to talk about intergenerational living and the pros and cons, everything that's involved. We've got Dr. Chris from Smile Design on with us today for a couple of segments. Yeah, it's going to be a lot of fun. Got a lot of great things, programs that he's got going that are going to be really neat to learn about. So if you're a dental phobe, this is the show you want to listen to, because if anybody's going to put your mind at ease, it's this guy.
Yeah, he's got the most gentle touch in the county.
Absolutely. And I'm one of those. You know, I am not pro dentist. I am scared of dentists. Have been since I was a kid. So I'm excited about this. There's a lot for me to learn. A lot of questions in my head. So.
Well, and he also knows so much about so many different topics that I am really interested to know how many you guys can cover in the time he's going to have to come back.
So stay tuned. Stay tuned. It's going to be quite a marathon today. And then at the end of our show, we're going to be talking about how important, kind of, coming on the back of what we're talking about here first, how important it is for people to have interaction and to be close to each other and build those relationships. So going to be a fun show. We want to hear from you today. We're live in studio, 984-1234, or get us on Facebook or Twitter, NHR Hour, or you can always send us an email at radio@nationalhealthreview.net.
Yes, please do.
Welcome back to the National Health Review Hour. This is your host, Andrew Gall. And great first segment. Glad to have Cynthia, as always, on the mic with us. And I've got here Dr. Chris Edwards. How are you, Dr. Chris?
Very well, thank you.
Good to have you with us in studio today. And Dr. Edwards is from Smile Design. And what's the name of your practice? Dr. Chris Dentistry, or just Smile Design? Is that?
Well, Smile Design Center is the name of my practice.
Okay, great.
And that's up in Vieira. And it's a little misleading because I came to Florida thinking I would be a smile designer, as cosmetic dentistry is one of my passions. Sure. But it has really morphed into being a more, whole person, comprehensive dental practice.
That's awesome. And comprehensive dentistry, sometimes people hear words like that and they think, oh, that's just a buzzword. But for you, comprehensive dentistry really is your approach to the way that you practice, dentistry and working with people.
Well, it's holistic is sort of a word that's bandied about a lot today and means a lot of things to a lot of people. But I think comprehensive dentistry really involves looking at the whole person. And listening to their story. If you're an apprehensive person, to be able to address that right in the beginning just eases things right off the bat.
Definitely.
And certainly the concerns you've had, the history you've had, what happened to your parents, and what are your dreams or your hopes. And then from there, it really involves quality, thorough diagnosis. And that's something I think that sets my practice apart, is that we spend 2 hours for a new patient exam, and that does not include the cleaning. That's just really the exam and the co-discovery, the opportunity for the patient to really learn about their mouth and what's going on.
Yeah, and people often think of their teeth as kind of like this isolated, they have a doctor who's just for their teeth, and so they don't think of their teeth necessarily as part of their whole wellness spectrum. The teeth are for the dentist, but it really has so much to do, and we're going to talk a little bit kind of about cardiac issues and those kind of things in a minute. But, talk to us a little bit about just how, the health of your mouth fits into the health of your whole person and how those really work together.
Well, we are what we eat, and the ability to...
That's bad for me.
The ability to masticate our food properly is so hugely important in our overall health because digestion starts in the mouth. And the ability to break the food up properly and to add the saliva and the beginning enzymes to the food just creates the rest of the system to work properly. So, having a healthy mouth is important for overall health. Then there's the whole component of speech and smiling and how we look at the world and how the world looks at us and how we feel about how we look. And a lot of times that influences how healthy we are, how we feel we are is how we are. So so that's important.
And now a lot of people, they heard oh man, they're gonna have a dentist on, and it was like that automatic tune out. I don't want to listen. Dentists are scary. How do people overcome that fear of being in the chair, talking to a dentist, and really getting past that so they can really help themselves be healthy?
Well, what I think in my case. I give a lot of the credit to my staff. That, you know, we have worked together as a team. We've been training, you know, for years on how we can better serve our patients and how we can help them through that process. And although I do the diagnosis, you know, and I spend a good hour and a half with the patients really spend a lot of time with my staff, and they're the ones that, the person that's next to you, that makes you feel more comfortable. You know, I'm the guy with the drill, and, you know, sometimes I have to use needles, you know, and, but ultimately, you know, I think it's a lot of it is just the energy of, you know, being in an environment that is caring. You know, we use aromatherapy for a lot of patients, headphones, and, you know, good music, and,
Sure.
You know, and just an overall feeling of calmness when you walk through the door, that this is a place that feels right.
I know if you're listening, you know, a lot of times the thing that contributes to the fear of going into a dentist's office is all the unknowns, all the question marks. If you've got questions for Dr. Chris, give us a call at 984-1234. We're live in studio today, and he'll be glad to answer those. Now, Dr. Chris, talk to us about some of the tools that you use in your practice that really set you apart. I know you do some things with lasers and that kind of thing. Talk to us a little bit about that and why that sets you apart from the rest of the field.
Well, technology, you know, is something that we all embrace, and it's part of our everyday life. And in dentistry, technology has just expanded, and it becomes actually a challenge to figure out what technology do you add to your practice or do you use. So for myself, I think that the technologies that set me apart are the fact that I do all of my work through the surgical microscope, which is where I am able to change the magnification of what I'm looking at up to 20 power,
Wow.
which is unbelievable. And the illumination with the microscope is so absolutely perfect because it's exactly the field of your vision. So that has enabled me to look really hard at my own work and to really make sure that I am at the highest level and things are fitting properly and that I'm able to work at a higher tolerance.
Explain to our listeners, you know, hearing something like a surgical microscope, that even almost sounds a little big and scary. Tell them why, you know, that's good for them. Why, you know, when you're looking at my mouth, explain to them why that's going to be good, that is how you approach it and how that's going to help them.
Well, when you look at dentistry, the mouth is a difficult environment to be able to do work in. And, you know, when I'm putting a filling in a tooth or a crown on a tooth, let's say, and I want that crown to last 20, 30, 40 years, the detail of how well that preparation is cut, you know, with the diamond burr, the impression technique that's taken to be able to capture that margin very accurately, the ability to look at the fit when you're going ahead to cement it and control the gum, all winds up resulting in a product that is really done to the highest level and can stand up to the environment in the mouth. All of the temperature changes, the constantly in liquid, the bacteria, acids, you know, all kinds of things. So, you know, so it's a question of, you know, technical detail, and the patient really can't tell the difference on that.
Yeah, and, you know, if you're like me and you're listening, you know, when it comes to doctors, yeah, I want the best I can find. I want a specialist. I want this. I want that. When it comes to our mouth, I'm scared of the dentist, so let me get in, let me get out, let me do as little as possible. And you allow people to really, you know, come into an environment that, you know, makes them feel safe, that makes them feel at ease. And then on top of that, you give them the best possible care. You're the specialist, you know, for mouth care. And that's really important. Now, you do some special work with laser surgery. And people don't often think of laser surgery in the dental practice. So tell us a little bit about what you do and how that's beneficial for your patients.
Well, lasers they're just amazing things because all it is packets of light.
Yeah.
And they're at different frequencies. And actually, I have 4 different lasers, but I do have a laser called a Water Laser MD, which is a water laser.
Wow.
And what's really neat about that laser is that it actually works at the frequency of water. So the light is actually exploding the water that's at the tip where the laser comes out, and it's the explosion of the water that actually ablates the tooth or, you know, blows a little piece of the tooth apart, and it attracts the water in a cell and actually explodes the cell.
Wow.
But what's really neat is that the adjacent cell right next to it does not get affected in an adverse way. And actually, the adjacent cells to where the surgery is being performed are picking up the light, and the cells are using the light for healing.
It's like a smart bomb for your mouth.
And the healing after using the laser is just phenomenal.
Wow.
Because it avoids the inflammatory response that happens when we use any other kind of surgical modality. If we use a scalpel or a curette or a sharp instrument, the body goes through a process of inflammation which requires pain, bleeding, swelling.
So I'm not walking out of your office with a mouthful of gauze.
But no, and the laser is used in so many different ways. I can actually drill teeth with it.
Wow.
And in a deep cavity, I can go ahead and somewhat disinfect or sterilize the tooth, kill any remaining bacteria, and the actual light gets sent through the remaining tooth and into the pulp of the tooth, and the cells on the inside of the tooth are actually picking up the light and are regenerating, and it's helping stem cells to differentiate. So the laser, it's pretty amazing for healing.
It's incredible.
It is incredible.
In what situations can people, think, okay, I'm going through this in my mouth, I need to look for somebody with a laser? What kind of situation should people be beginning to think of that as an option? Or are all of the dental practices, what kind of situations do you use it in?
Well, I would say that I use my laser numerous times every day, my water laser. And, it's excellent for trimming and contouring tissue. So when you're working, let's say, on a crown where it's deep under the gum and you need to be able to recontour the tissue so you can see what you're doing and you can get that impression, that's excellent. I can just trim the gum away so that it's going to heal just the way it should be, so that when the patient comes back in 3 weeks, I've got a healthy gum that I'm putting a crown on, and I'm not fighting any bleeding. And so I use it in soft tissue a lot of times. I use it in implantology. When I'm doing any kind of extractions, I'm going ahead and cleaning out any infection that's related to it. I'll use it in cavities, in deep cavities particularly. And I can actually drill into a tooth without actually having to numb the patient, because the laser actually fools the nerve on the inside of the tooth to a point where the sharp pain sensation is gone. There's some sensation, but it's, for those patients that are, deathly phobic of the needle, it's a fantastic thing.
Now, I have read that in some cases the laser surgery can actually be safer than traditional forms of surgery. How and in what cases is that true?
Well, again, as I said, it's non-invasive. Mm-hmm. So you're not damaging any adjacent tissue, and it sterilizes so that there's no bacteria that are involved with it. It's very precise, so that, again, working under the microscope, I'm watching each little blip of the laser and watching exactly what it does. So it's totally safe. There's nothing that there's no negative to the light at all.
That's awesome.
Yeah.
If you're listening and you've got questions, this is just a whole new way for me to think about going to the dentist office. This is incredible. But you've got questions for Dr. Chris, please give us a call at 984-1234. You can email us at radio@nationalhealthreview.net. We'd love to hear from you, love to hear your questions. Now, Dr. Chris, we talked a little bit at the beginning of the segment about how, the health of our mouth relates to the health of, the rest of our bodies. And there have been some studies recently that really kind of showed the correlation between gum health and heart disease. And we want to talk just for a quick couple of minutes, and then we'll talk about it more in the next segment. But explain to us kind of how that works and what the issues that people need to be aware of are.
Well, it's really interesting because we don't have the exact answer of what happens. But epidemiologically, which means the study of disease, has shown a clear-cut correlation that if you have disease in the mouth, not just gum disease, but inflammation basically, and that's what gum disease really is an inflammatory process, that you have a 5 or more times higher chance of having a stroke or a heart attack.
Wow.
And I can say that I've personally seen it in my own practice, where I've had healthy guys, healthy patients have a heart attack. Yet, when I look back at their chart, as a matter of fact, as soon as I heard it, I said, they had untreated gum disease for whatever reason. Not that I didn't want to treat it, but for whatever reason, they never finished treatment or got it totally squared away. Mm-hmm. So there is a connection that's undoubted between the two. We think it relates to the inflammatory response. And also, we know that bacteria can actually get into the bloodstream through the gums.
Wow.
And if the gums are inflamed, and if your gums bleed, you have gum inflammation, the inner lining of the gum between the tooth and the gum, that instead of being like a good piece of skin, is actually a very raw kind of material that is where your body is actually trying to get those bacteria that are on the side of your tooth.
Wow.
But they
so it's
can't.
like the body's trying to push away from the tooth itself.
No,
because
no.
of the bacteria.
Well, the body senses the bacteria.
Yeah.
And it wants to engulf it. For example, if you got a cut or in your skin and bacteria got into your body quickly surrounds and engulfs the bacteria, your white blood system, your immune defense, and basically can take and destroy that pathogen.
Wow.
and get rid of it. Well, those bacteria are effectively outside your body because although they're living on the side of your teeth, your bacteria can't grab those pathogens.
Wow.
And therefore, it's a constant 24/7 battle of your body trying to fight these bacteria.
This is fascinating, and we're going to have some more questions as soon as we get back from our break. Please stay tuned. 1560 AM WINT. You're here with the National Health Review Hour with me, your host, Andrew Gall, and Dr. Chris Edwards. Don't go away. We've got a lot more questions for Dr. Chris coming up. National Health Review Hour. Welcome back to National Health Review Hour. This is your host, Andrew Gall, here on 1560 AM WINT, in studio with Dr. Chris Edwards from Smile Design. How are you, Dr. Chris?
Thank you.
You having fun?
You know what? I'm enjoying this.
This has been a fascinating conversation for me. I am a avowed dental phobic. I am scared of the dentist, have been since I was a kid. Cynthia is too. And this has just been mind-opening for me. In where dentistry has come and what's available, the options that are available that I didn't even realize. Talked a little bit about the laser surgery that you do. If you've got questions for Dr. Chris today, any concerns, the best way to brush your teeth, how often you're supposed to floss, anything like that, or specific questions about his surgical methods with, we talked about the water laser and those kind of things, please give us a call, 984-1234. We're live in studio today, and we'd love to hear your questions. Now, we talked, just before we went to the break, we were talking about the correlation between gum health and heart health and how important those issues are. That being said, what can people be doing as an active part of their lifestyle to promote good gum health and make sure that their mouth is healthy the way it should be?
Well, it really boils down to what we call plaque control. Okay, and plaque is the normal buildup of the bacteria coating the teeth, and and it's normal for us to have bacteria in our mouth, and there's up to over 200 different bacterium that could be living in our mouths, numerous for each of us.
That's exciting.
And
glad we're not talking about this before dinner.
Well, we actually have a dark field microscope at my office, and we will actually take a sample of your plaque, and we will let you see the actual bacterium, crawling around. And depending on the kind of bacterium, it can give us a prognosticator of the health in your mouth.
Another thing you don't want to do before you eat. Yeah, that's awesome.
So anyhow, the plaque is normal to grow on our teeth, and we need to remove it once every 24 hours. And that means a thorough mechanical removal of the plaque, which really boils down to good brushing and good dental flossing. Dental floss is probably singularly the most important thing you can do for your oral health.
Wow.
Because it will help prevent cavities between your teeth, which is commonly what happens once we've gone through childhood, and it's the best thing for gum health. Now, the soft deposits are able to be removed, but the hard deposits where the plaque calcifies and becomes calculus or tartar are areas that you, the patient, cannot remove, and those must be taken off professionally by the dental hygienist.
How often should somebody go in for a cleaning?
Well, you know what? We custom tailor that for every patient. I have some patients that only need to come once a year. I have many patients that need to come every 3 months. 6 months is sort of if you're healthy and you've got some buildup, commonly 6 months is the number, but it varies every patient. And we treat everybody individually, and and it depends on how well you're doing. What's the patient's part.
And yeah, I was just going to mention that a lot of that probably has to do with your own concern about the health of your mouth and what you're doing to take care of that. Now, as far as brushing and flossing, a lot of people say, okay, I brush, I floss, but a lot of people don't do it right. They don't do it correctly. What are some, your handy dandy tips to make sure that when you brush, when you floss, you're doing it productively and taking the best care of your mouth that you can?
Okay, well, one thing is time yourself. Put a timer on and brush your teeth for 2 minutes. And this is actually interesting because most of us brush for like 30 seconds.
That's me. My wife's sitting over there looking at me because she always tells me, you should brush your teeth longer. And
I believe that some of the automatic toothbrushes are superior to the manual toothbrushes, but even they are only as good as the operator. The Sonicare is, I think, probably the most respected and does the best job out there. And definitely flossing so that you get all the way under the gum. You want to be able to curve the floss to really wrap the side of the tooth and slide the floss as far as you can under the gum without damaging the gum. Flossing is really all about polishing the side of the tooth as opposed to doing anything to your gum. Huh. You shouldn't be hurting your gum at all.
I didn't know that. Now, does diet and what you eat, not necessarily, cleaning after you eat, but what you eat, does that affect the health of your gums and the health of your teeth? And what should people be making sure is a regular part of their diet to keep their mouth healthy?
Well, diet is obviously very important. And, there's the whole aspect of sugar, because with decay, the bacteria that are in the mouth will eat the sugar that we eat. And that sugar could be a piece of bread or a banana. It's not just a can of Coke.
Oh, wow.
And for about 20 minutes, those bacteria will produce acid. The acid is what decalcifies the tooth and makes the tooth porous so that the bacteria can eventually break through the hard enamel to the inner part of the tooth and start eating the inner part of your tooth. So somebody that has a can of soda on their desk and nurses it for 2 or 3 hours is absolutely doing the worst thing for their teeth, or a person that pops a mint every half of an hour. So if you're going to have sweets, have it with your meal. And then if you can, brush. If not, at least rinse or rinse your mouth out even with water and minimize that input of sugar into your mouth.
Huh. So somebody who says, I don't drink that much soda, I just drink one, but they drink it through the afternoon, could be doing as much damage as somebody who's drinking 3 or 4 over the course of an afternoon.
Some of these new energy drinks are actually worse than soda. Wow. As far as their acidity and the ability to really wreak havoc in the mouth. And a lot of them are full of sugar also. And, they're definitely a problem.
Now, diet and nutrition is a huge part of what we talk about here on the National Health Review Hour. What can people be replacing? It's always easy to say just get rid of it, but a lot of times we need to replace things, in our lifestyle so that, because it's easy to go back to something if there's a hole there. So what can people be replacing these kind of products with that is going to be good for their mouth and still kind of meet the needs that they're looking to have met?
That's a great question, because that sort of segues nicely into Dr. Xylitol, which is a moniker or a name that I've taken, because when I discovered that xylitol, which is a natural sweetener, can actually help change the ecology of the mouth and get rid of the Streptococcus bacteria, which is the bad boy that creates the acid, now for the first time we finally have a sweetener that's good for us that can actually benefit our oral health. Wow. And so xylitol is a great thing, to be able to sweeten your food with xylitol, sweeten your drinks with xylitol is a great thing. And there are some great studies that have been done that show that a consistent use of xylitol over a period of time can actually change the environment in the mouth to really reduce decay significantly. And these are good scientific research studies that have been done and have been replicated all over the world.
Wow. Now, I know Dr. Chris has some great information on his website. If you'd like to know more, especially about xylitol, there's a great video. He's got a segment on his website called Smile Tube. You can go to his website at smiledesignCenter.us And click on SmileTube. You can watch a seminar that you did about xylitol and the benefits of the body and those kind of things, correct?
Yes. It was at the Health Expo about 3 or 4 years ago, or maybe 5 years ago, where I was able to tape that and edit it down and put it on my website. So if you really are interested to learn about xylitol, it's an excellent, it'll take you probably 25 minutes to watch the whole video, but you really will understand a lot of the benefits, because there's benefits far-ranging beyond the oral benefits of it. And it's a natural product that our body actually makes in its own glucose metabolism. So it's not foreign to us at all.
That's great. Now, we talk a lot about, whole person health, and a big part of that is self-image, and the way we perceive ourselves is really important in leading a healthy and happy life. You're the Smile Design, and you do a lot with cosmetic dentistry and those kind of things. Talk to us a little bit about how you help your patients and really help them create a happier life by helping them be happy with the personal image that they have.
Well, again, it all comes back to good diagnosis, because Smile Design really relates to the whole person. You have to have a healthy bite to be able to rebuild somebody's front teeth so that it's going to last. And you have to have healthy gums and periodontium. And Smile Design can relate to gum, the shape of the gum, as much as the shape of the tooth. And again, the laser is the optimal treatment to be able to recontour or reshape the gum.
Wow.
And there's no one size fits all for Smile Design. A lot of times, just a little bit of reshaping of one tooth can have a dramatic effect. A little bit of whitening of the teeth, or changing a couple of discolored fillings to 10 porcelain veneers, instant orthodontic case, where somebody that's teeth are really crooked could all of a sudden walk out and have a movie star smile.
Wow.
And everything in between. And, so it's individual per person.
Now, is the work that you're talking about in reshaping the gums, reshaping the teeth, is that a possible replacement for traditional orthodontry?
Absolutely. Absolutely. As a matter of fact, a lot of the people are what we would call an orthodontic failure, those people that didn't wear their retainer and teeth shifted and drifted back, and they're just not interested in going ahead and going back into braces, because if you go back into braces, guess what? You have to wear your retainers for the rest of your life.
Yeah.
And it's a sentence, and
Wow.
and that's something that's a choice. And for some people, that's what they want to do. But for a lot of people, it's like, I don't want to go through that again. And especially if I've got to wear retainers the rest of my life. So with quite simply, we can go ahead and prepare the teeth as minimally as possible to all of a sudden create a whole new shape. And we do this in wax first. We actually take somebody's mouth, we'll make models of their teeth. We do a lot of extensive photographing and videoing, and then we'll go ahead and predict in wax what we can do. And sometimes we'll be able to actually do in the mouth, be able to do a mock-up and show the patient, in a matter of minutes, what it would look like.
Wow.
And we have imaging also. We can do it digitally, where we can take a photograph and we can start, on the computer, changing lengths and shapes and colors and all of that.
That's incredible. If you're listening and you're like me, you've never talked to a dentist like Dr. Edwards before. This is really incredible. We are going to make sure that we have all of this information available on our website, nationalhealthreview.net. Just click on the radio icon. But you can also go to Dr. Edwards' website, smiledesigncenter.us, and he's got some great videos there, SmileTube and so forth. Talk to us just a little bit more before we have to go here, Doctor, about the cosmetic products that you offer and how people oftentimes they'll live in denial of, no, I don't need this. I don't need braces. I don't need to go see a dentist about this. I don't need cosmetic dentistry. When should people, or they think it's too expensive, they're scared by those kind of things. What would you tell those people to help them kind of overcome those initial fears that are in their head and really do something that's going to be good for them?
Well, again, it goes back to good diagnosis, and it really goes back to the patient being offered what the choices are, because until we don't know what we don't know.
Right.
And ultimately, to be able to sit down and look at your teeth on a blown up on a big screen, and to be able to see a video of the inside of your mouth, then you are able to start understanding what the choices are, and to be able to say, well, we could just do 2 teeth or 1 tooth, or maybe 4 teeth, and we'll come back maybe and we'll see how that looks and come back and do 4 more. and maybe it's crowns that you need, or maybe veneers, or maybe it's just really whitening or reshaping, or maybe it's a gum reshaping, a gum lift, as opposed to really doing anything to the teeth. So it's really, I think, about having the opportunity to sit down and look at where you're at, what your dreams are, and then what your choices are. And I think that's where my staff are excellent, because they're the ones that actually present the choices to the patient.
That's fantastic. Well, folks, if you listen today, you have had a treat to hear really an incredible professional in his industry and in the medical community as a whole. You don't meet very many people who are willing to be upfront with you about this is what you need, this is what your options are, and we just want to do the best for you. And Dr. Edwards, that's what it sounds like you're all about, and that's so fantastic. Thanks so much for being here with us today.
Andrew, it's been my honor actually to be here, and and if I can be of service to, anybody, please give us a call, and I'd be happy to, do whatever I can.
Absolutely. And you can get in touch with Dr. Edwards. You can give him a call at 321-751-7775, 321-751-7775. Look at his website, smiledesigncenter.us, and we'll have all that content up. Coming up next, we're going to have Cynthia back on the air with us, and we're going to be talking a little bit about how important personal relationships are. You don't want to go away. This isn't the same segment as last week, so stay tuned. Great information coming up for you here on the National Health Review Hour, 1560 AM WINT.